In this video, we will discuss about hypertension or high blood pressure. The predominant mechanisms of blood pressure control are the central nervous system, the renin-angiotensin aldosterone system, and the extracellular fluid oleum. We don't know the reason of why the mechanism fail and cause changes in blood pressure. What is blood pressure? Blood pressure is the measurement of the pressure or force of blood pushing against blood vessel walls. BP is the force exerted by the blood against the walls of the blood vessel. Blood pressure is actually a measure of two pressures, the systolic and the diastolic. Blood pressure is measured in millimeters of mercury. What is systolic pressure? The systolic pressure is the higher pressure and the first number recorded. It is the force that blood exerts on the artery walls as the heart contracts to pump the blood to the peripheral organs and the tissues. What is diastolic pressure? The diastolic pressure is the lower pressure and the second number recorded. It is residual pressure exerted on the arteries as the heart relaxes between beats. It shows how much pressure is in the arteries when the heart relaxes between beats. For example, if the pressure is recorded as 120 by 80, 120 is systolic pressure and 80 is diastolic pressure. So what is hypertension? Hypertension is defined as a systolic blood pressure greater than 140 mmHg and diastolic pressure greater than 90 mmHg based on two or more measurements. Hypertension can be classified into different stages. The normal is systolic less than 120 mmHg, diastolic less than 80 mmHg. Pre-hypertension or elevated, systolic between 120 and 139, diastolic between 80 and 89. Stage 1, systolic 140 to 159, diastolic 90 to 99. Stage 2, systolic 160 above and diastolic 100 above. Hypertension crisis occurs when the blood pressure goes above 180 by 120 mmHg. Hypertension is a disease of vascular regulation in which the mechanisms that control arterial pressure within the normal range are altered. High blood pressure is a common condition that affects the body's arteries. If a person has high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. This damages the arteries over time and it can lead to serious complications like heart attack and stroke. BP must be adequate to maintain tissue perfusion during activity and rest. Maintaining normal BP and tissue perfusion requires the integration of both systemic factors and local peripheral vascular effects. BP is mainly a function of cardiac output and systemic vascular resistance. BP is called as a silent killer because clients usually don't have any symptoms. Hypertension typically develops over several years, usually without causing any symptoms. So, person may not be aware that anything is wrong, but the damage is still occurring within the body. But even without symptoms, high blood pressure can cause damage to the blood vessels and organs, especially the brain, heart, eyes, and kidneys. It is a dangerous condition and it contributes to hardening of the arteries or atherosclerosis, stroke, kidney disease, and heart failure. However, high blood pressure can have a big impact on the health, so it is important to understand what it is, what causes it, and how can we lower it. Early detection is important. Regular blood pressure readings can help a client and a doctor notice any changes. If the blood pressure is elevated, a doctor may check the blood pressure over a few weeks to see if the number stays elevated or falls back to typical levels. Now we will see the types of hypertension. There are two types, primary hypertension and secondary hypertension. Primary hypertension. When there is no demonstrable underlying cause of hypertension, the condition is classified as essential hypertension or primary hypertension or idiopathic hypertension. This is by far the most common type of high blood pressure, occurring in 90 to 95% of people. Genetic factors appear to play a major role in the occurrence of essential hypertension. Causes of this type of hypertension include aging and lifestyle factors like not getting enough exercise. Next is secondary hypertension. Causes of this type of high blood pressure include different medical conditions or medication patient is taking. Secondary hypertension is associated with an underlying disease which may be renal, neurologic, or endocrine in origin. Examples of such disease include glomerulonephritis, that is, inflammation of the urine-producing structures in the kidney, atherosclerosis of blood vessels in the brain, and Cushing's syndrome, that is, hyperactivity of the adrenal glands. In cases of secondary hypertension, the correction of the underlying cause may cure the hypertension. Various external agents also can raise blood pressure. These include cocaine, amphetamines, cold remedies, thyroid supplements, corticosteroids, non-steroid anti-inflammatory drugs, and oral contraceptives. High blood pressure that comes or goes in certain situations. These hypertension types are white coat hypertension. The BP is normal at home but elevated in a healthcare setting. Masked hypertension. The BP is normal in healthcare setting but elevated at home. Sustained hypertension. The BP is elevated in healthcare settings and at home. Nocturnal hypertension. The BP goes up when a person sleeps. Malignant hypertension is present when there is a sustained or sudden rise in diastolic blood pressure exceeding 120 mmHg with accompanying evidence of damage to organs such as the brain, eyes, heart, and kidneys. Malignant hypertension is a medical emergency and requires immediate therapy and hospitalization. Now we will see the causes of hypertension. In most cases, there isn't a specific reason for the cause of high blood pressure, but most people develop it because of their diet, lifestyle, or medical condition. The blood pressure depends on how much blood the heart pumps and how difficult it is for the blood to flow through the arteries. Things that affect either of these factors, such as being dehydrated or having narrow arteries, can impact the blood pressure. Several things may play a role in causing high blood pressure. Depending on what is causing the high blood pressure, determine which type of hypertension a person has. It can be primary or secondary. Some can have one or both types. Causes of primary hypertension. Primary hypertension or essential or idiopathic hypertension is elevated BP without an identified cause. It accounts for 90 to 95% of all cases of hypertension. When there isn't an obvious cause of high blood pressure, it is called primary or essential hypertension. Essential hypertension has been linked to certain risk factors in the diet and lifestyle. For example, eating a lot of salt can cause the blood pressure to rise. Many people with this condition are sensitive to salt, so even eating a small amount can trigger a spike in blood pressure. Primary hypertension doesn't have a single clear cause. Although we do not know the exact cause for primary hypertension, there are many contributing factors. These factors include changes in endothelial function related to either vasoconstricting or vasodilating agents. It can be because of increased SNS activity. It can be because of overproduction of sodium-retaining hormones. Increased sodium intake. High sodium intake can contribute to hypertension in salt-sensitive patients. Salt causes the body to hold on to water. This increases the amount of blood being pushed through the arteries. Increased salt intake decreases the effectiveness of certain antihypertensive drugs. Unhealthy eating patterns, including a diet high in sodium and insufficient intake of potassium, calcium, and magnesium. A diet high in saturated fat and trans fat and low intake of fruits and vegetables. Potassium helps balance the amount of salt and water in the body. Dehydration also can affect the potassium levels. Systolic blood pressure rises progressively with age, especially after age 50. Excess alcohol use is associated with hypertension. Moderate alcohol use can have a cardioprotective properties. Hypertension is more common in patients with diabetic. When hypertension and diabetes coexist, complications are more severe. Incidence of hypertension is higher in blacks. Family history. History of a close blood relative with hypertension increases the risk for developing hypertension. Hypertension is more prevalent in men in young adulthood and early middle age. After age 64, hypertension is more prevalent in women. Increased serum lipids, increases cholesterol and triglyceride levels are primary risk factors for atherosclerosis. Hyperlipidemia is more common in people with hypertension. Being overweight or obese. Extra weight impacts the heart and blood vessels. For example, it can cause high cholesterol. Risk increases with central abdominal obesity. Weight gain increases the frequency of hypertension. People who don't exercise tend to have higher heart rates. Regular physical activity can help control weight and reduce cardiovascular risk. Physical activity may decrease blood pressure. Hypertension is more prevalent in lower socioeconomic groups and among the less educated people. People exposed to repeated stress may develop hypertension more often. Feeling nervous or stressed can temporarily raise the blood pressure. When this happens at the doctor's office, it is called the white coat syndrome. People who develop hypertension may respond differently to stress than those who do not develop hypertension. When a person smokes, vape, or chew tobacco, the blood pressure temporarily increases. Over time, regular smoking can damage and harden the blood vessels. Smoking tobacco greatly increases risk for cardiovascular diseases. Researchers believe genes play a role in high blood pressure. If one or more of the close biological family members have high blood pressure, person has an increased risk of developing the high blood pressure. Lifestyle changes like eating a healthier diet, quitting tobacco, and being more active can help lower the blood pressure. Some people may still need to take medicines. Causes of secondary hypertension. When a direct cause for high blood pressure can be identified, the condition is described as secondary hypertension. This type of high blood pressure is caused by a different health condition. It is usually more sudden and severe than essential hypertension. Secondary hypertension has at least one distinct cause. There are many different conditions or diseases that can cause secondary hypertension, including renal pathology. These include chronic kidney diseases, congenital anomalies, pyelonephritis, renal artery stenosis, acute and chronic glomerulonephritis, and obstructive uropathy. Reduced blood flow to kidney causes release of renin. Renin reacts with the serum protein to form angiotensin 1, which is converted to angiotensin 2 through the action of angiotensin converting enzyme in the lungs, leading to vasoconstriction and increased salt and water retention. Kidney disease is the most common cause of secondary hypertension. Endocrine disturbances include adrenal disorders. Hypertension can also be triggered by tumors or other abnormalities of adrenal glands. Adrenal glands are the small structures that sit atop of the kidneys. Adrenal tumors or disorders can cause them to release too much of the hormones that elevate blood pressure. Primary aldosteronism or Conn's syndrome, also known as primary hyperaldosteronism, refers to the excess production of the hormone aldosterone from the adrenal glands, resulting in low renin levels and high blood pressure. Pheochromocytoma, a tumor of the adrenal gland that causes release of epinephrine and norepinephrine and a rise in blood pressure. Adrenocortex tumors lead to an increase in aldosterone secretion and an elevated BP. Cushing's syndrome is a hormonal condition that occurs when a person's cortisol levels are too high, causing sodium and fluid retention and hypertension. Hyperthyroidism causes increased cardiac output. Too much or too little thyroid hormones can affect the blood pressure. Coarctation of aorta or stenosis of aorta. Blood flow to the upper extremities is greater than blood flow to the kidneys. Low blood flow to the kidneys release renin. Congenital heart defects. Some people are born with heart or blood vessel problems. Obstructive sleep apnea. This condition causes breathing problems and lack of oxygen. This can harm the arteries and causes nocturnal hypertension. Cough, cold, and pain-relieving medications can temporarily raise blood pressure. Certain medications can constrict blood vessels, making it harder for the heart to pump blood. Medications including immunosuppressants and oral contraceptive pills. Some over-the-counter and herbal medicines can also boost blood pressure. Prescription medications such as estrogens and steroids cause fluid retention. Sympathomimetic drugs can cause vasoconstriction and tachycardia. Antidepressant drugs can prevent the breakdown of epinephrine. Appetite suppressants can cause tachycardia and vasoconstriction, and NSAIDs can cause fluid retention and can lead to renal insufficiency. Non-prescription drugs and substances such as cocaine can cause vasoconstriction and tachycardia. Antihistamines can cause vasoconstriction and tachycardia, and nicotine can cause vasoconstriction. Recreational drug use, including amphetamines and cocaine, can raise blood pressure. Food substrates such as sodium chloride, ethanol, licorice, and glucose, all of which can cause increased fluid retention and thus cause hypertension. Around 1 in 10 women develop high blood pressure during pregnancy. This increases the risk of long-term high blood pressure. Lowering the blood pressure of birth mothers within 6 weeks of giving birth reduces their long-term risk. Sometimes hypertension suddenly appears or gets worse during pregnancy. When hypertension develops after 20 weeks of pregnancy, it is called preeclampsia. It is normal for the blood pressure to go up and down throughout the day. Many things can temporarily raise blood pressure. For example, the blood pressure might rise after a stressful event, smoking or drinking alcohol. But when the blood pressure rises too much, it can be a medical emergency. This is called a hypertensive crisis. It happens when the blood pressure is higher than 180 mmHg and higher than 120 mmHg. It can cause symptoms such as difficulty breathing, racing heartbeat, chest pain, anxiety, headache, dizziness, nausea, trouble speaking, vision problems, and nosebleed. Now, let us see the pathophysiology of hypertension. Blood pressure is the product of cardiac output multiplied by peripheral resistance. Cardiac output is a product of the heart rate multiplied by the stroke volume. Each time the heart contracts, pressure is transferred from the contraction of the heart muscle to the blood, and then pressure is exerted by the blood as it flows through the blood vessels. The body maintains normal blood pressure by balancing peripheral vascular resistance and cardiac output. Individuals with arterial blood pressure are more likely to have elevated cardiac output, leading to systemic vascular resistance. For high blood pressure to occur, an increase in peripheral resistance and or cardiac output must occur secondary to increased sympathetic nervous system activity related to dysfunction of the autonomic nervous system, increased renal reabsorption of sodium, chloride, and water related to a genetic variation in the pathways by which the kidney handle sodium, increased activity of the reninangiotensin aldosterone system, resulting in expansion of extracellular fluid volume and increased systemic vascular resistance, decreased vasodilation of the arterioles related to a dysfunction of the vascular endothelium, resistance to insulin action, which may be a common factor linking hypertension, type 2 diabetes, hypertriglyceridemia, obesity, and glucose intolerance, activation of the innate and adaptive components of the immune response that may contribute to renal inflammation and dysfunction. Blood pressure rises with any increase in cardiac output and systemic vascular resistance. As hypertension progresses from elevated stage to stage 1, there will be an increase in both blood volume and cardiac output, leading to an increase in systemic vascular resistance. As hypertension progresses, SVR rises and cardiac output returns to normal. The hemodynamic features of hypertension is a persistently increased SVR. This persistent increase in SVR may occur in several ways. Abnormalities of any of the mechanisms involved in maintaining normal BP can result in hypertension. Hypertension can result from increase in cardiac output, increases in peripheral resistance, or both. Increases in cardiac output are often related to an expansion in vascular volume. Although no precise cause can be identified for most cases of hypertension, it is understood that the hypertension is a multifactorial condition. For hypertension to occur, there must be a changes in one or more factors affecting peripheral resistance or cardiac output. In addition to that, there must also be a problem with the body's control systems that monitor or regulate blood pressure. Many neural, endocrine, renal, and cardiovascular control system influence vascular and cardiac hemostasis, increasing the complexity of hypertension's pathophysiology. These factors differ among populations because gene-environment relationship modify them. The tendency to develop hypertension is inherited. However, genetic profile alone cannot predict who will and will not develop hypertension. Therefore, high blood pressure's pathophysiology can be understood clearly by reviewing the role of its regulatory system. The renal system plays an important role in hypertension pathophysiology because kidney regulate blood pressure. The pathophysiology of hypertension involves the impairment of renal pressure natriuresis. Pressure natriuresis mechanism is the feedback system in which high blood pressure causes an increase in sodium and water excretion by the kidney that leads to a reduction of the blood pressure. Pressure natriuresis can result from impaired renal function, inappropriate activation of hormones that regulate salt and water excretion by the kidney, such as in the renin-angiotensin aldosterone system, or excessive activation of sympathetic nervous system. In human essential hypertension, volume regulation and the relationship between BP and sodium excretion, that is pressure natriuresis, are abnormal. Apart from renal factors, microcirculatory changes, neural mechanisms, and environmental factors are attributed to hypertension development, which arises from increase in peripheral resistance and increase in volume overload. Arterioles and small arteries control peripheral resistance. Thus, arteriolar reduction in density and changes in small arteries increase the risk of developing BP. Hypertension occurs when the body's smaller blood vessels narrow, causing the blood to exert excessive pressure against the blood vessel walls and forcing the heart to work harder to maintain the pressure. Narrow arteries create more resistance for blood flow out of the heart. The narrower the arteries, the more resistance there is, and the higher the blood pressure will be. The arteries are normally stretchy, so they can cope with the blood pressure going up and down. Although the heart and blood vessels can tolerate increased blood pressure for months and even years, but with high blood pressure, the arteries lose their stretchiness, becoming stiff or narrow. Eventually, the heart may enlarge, a condition called hypertrophy, and be weakened to the point of failure. This narrowing makes it easier for fatty material, that is atheroma, to build up. This narrowing and damage to the arteries lining the heart or brain could trigger a life-threatening heart attack or stroke. Hypertension carries the risk for premature morbidity or mortality, which increases as systolic and diastolic blood pressure rise. Prolonged blood pressure elevation damages blood vessels in target organs such as heart, kidneys, brain, and eyes. Neural mechanisms also play a crucial role in the pathophysiology of hypertension because they control cardiovascular homeostasis. Sympathetic stimulation induces blood pressure through various mechanisms, including cardiac contraction, decreased nerve capacitance, the variation of water and sodium release, and peripheral vasoconstriction. Environmental factors. Populations living in non-industrial regions are less vulnerable to high blood pressure and age-related cardiovascular problems. Endothelial dysfunction is another important contributor to blood pressure elevation in the elderly. With aging, elevation in vasoconstriction such as endothelium 1 and decrease in bioavailability of the vasodilated nitric oxide occur. These biochemical changes have been associated with increased arterial stiffness and the development of isolated systolic hypertension. The autonomic nervous system plays an important role in the control of blood pressure. In hypertensive patients, both increased release of and enhanced peripheral sensitivity to norepinephrine can be found. In addition, there is increased responsiveness to stressful stimuli. Another feature of arterial hypertension is the resetting of the baroreflexes and decreased baroreceptor sensitivity. The renin-angiotensin system is involved at least in some forms of hypertension and is suppressed in the presence of primary hyperaldosteronism. Elderly or black patients tend to have low renin hypertension. Others have high renin hypertension, and these are more likely to develop myocardial infarction and other cardiovascular complications. Baroreceptors are a type of mechanoreceptors that sense changes in blood pressure and send signals to the brain that control heart rate and vascular tone. When blood pressure rises, baroreceptor activity increases, which leads to a decrease in heart rate and increase in vascular tone. Excess sodium intake is linked to the development of hypertension. Although most people consume a high sodium diet, only 1 in 3 will develop hypertension. When sodium is restricted in people with hypertension, their BP usually falls. This suggests that some degree of sodium sensitivity may exist for high sodium intake to trigger the development of hypertension. A high sodium intake may activate a number of systemic mechanisms. In clinical practice, there is not an easy or straightforward test to identify people whose BP will rise with even a small increase in salt intake versus who can ingest large amounts of sodium without much change in BP. The effect of sodium on BP has a strong genetic component. The effect of sodium is more significant in blacks and middle-aged and older adults. This can increase the risk of renal problems, endothelial dysfunction, and heart failure in these persons. Altered renin-angiotensin aldosterone mechanism. High plasma renin activity increases the conversion of angiotensinogen to angiotensin 1. This change in the RAS may contribute to the development of hypertension. Any rise in BP inhibits the release of renin from the renal juxtaglomerular cells. Based on this feedback loop, low levels of PRA is seen in patients with primary hypertension. However, only about 30% have low PRA, 50% have normal levels, and 20% have high PRA. These normal or high PRA levels may be related to excess renin secretion from ischemic nephrons. Insulin resistance and hyperinsulinemia. Defects in glucose, insulin, and lipoprotein metabolism are common in primary hypertension. These defects are not present in secondary hypertension and do not improve when primary hypertension is treated. Insulin resistance is a risk factor in the development of hypertension and CVD. These high insulin levels stimulate SNS activity, impair nitrous oxide-mediated vasodilation, promote vascular hypertrophy, and increase renal sodium reabsorption. Stress and increased sympathetic nervous system activity. Factors such as anger, fear, and pain influence BP. Physiologic responses to stress, which are typically protective, may persist to a pathologic degree, resulting in a prolonged increase in SNS activity. Increased SNS stimulation causes increased vasoconstriction, increased heart rate, and increased renin release. Increased renin activates the RAS, leading to elevated BP. People with high levels of repeated psychological stress develop hypertension more than those who have less stress.